Hi friends, today we're going to discuss about a very interesting topic that a lot of people will be interested in, tooth whitening. Today we'll discuss why should you get tooth whitening done, what are the myths around tooth whitening, and whether you should actually get tooth whitening done. Another important thing that a lot of people make a mistake is they buy over-the-counter tooth whitening agents and they get these tooth whitening done at home. Well, are these tooth whitenings that are done at home, are these safe? Whether you should be doing these at home at all or they should be supervised by a dentist. We're going to discuss all these topics today. So stay on and listen to this video till the end. Tooth whitening basically is a procedure where a tooth whitening agent is placed on top of your teeth, and once this tooth whitening agent is placed, they are primarily consisting of a chemical which is a peroxide. It could be a carbamide peroxide or a hydrogen peroxide of various concentrations, and based on the concentration of these peroxides they release nascent oxygen. Sometimes today we have advanced tooth whitening systems which are laser assisted or light assisted, where we can do a procedure which takes a couple of sittings in just one sitting and whiten the teeth faster. So these are some of the procedures that we do using tooth whitening, and once the procedure is done we have a jump of almost 3 to 4 shades of jump from what they originally were. Especially with the advanced tooth whitening, we sometimes achieve almost a 6 to 7 jump in the shade of the person's teeth, so that they look whiter in just a single sitting. Sometimes as soon as half an hour to 45 minutes in a 3-cycle sitting, you could have whiter, beautiful looking teeth. Well, so under the supervision of a dentist, if a dentist is doing these procedures and the dentist knows about your dental history, he would take all the precautions to see and evaluate you and give you the right percentage of carbamide peroxide or the bleaching agent or the tooth whitening agent which would suit you and which would be safe. Well, the problem arises when a lot of people go and buy over the counter these tooth whitening agents or these bleaching agents for their teeth, and they go home and get it done. So one of the common mistakes that people do when they start doing such things is they don't know how long this should be applied, what is the quantity of bleaching agent that needs to be applied, and whether, most important is whether this is safe, okay, for them and their teeth to get it done. So the discoloration of your teeth can be multiple things. That discoloration of your teeth can be because of smoking, because of spices, because of colas, because of coloring food that you eat, which can be removed by tooth whitening. One thing you need to remember is if there are stains or if there is tartar that is there on your teeth, these cannot be removed by tooth whitening alone. First you need to get a tooth cleanup done, over which a polishing and only then a tooth whitening, which is just to change the color of your teeth, would help. So it is important that you know what is to be done, when it is to be done, and when it should not be done. Okay, so a lot of times what happens is some people, they have discoloration of teeth or yellow stain on their teeth because their enamel is worn off. Okay, the enamel has gone, the whitish color, the transparent color or the layer of your enamel is gone, and the yellowish dentine, which is the second layer of your teeth, is exposed and seen. So when people go and get bleaching done for these exposed dentine, they have a side effect which is severe sensitivity of the teeth, because this bleaching agent could go inside the dentinal tubules and actually damage your dentinal tubules, damage your teeth and the pulp or the innermost layer where you have the nerves and blood vessels. You could have severe sensitivity which may require you to get a root canal and a cap done. So every discoloration is not a candidate for getting a tooth whitening. So it is important that you visit your dentist, get a checkup done and do the procedure under the right guidance and under the right supervision. So sometimes your dentist could say that, probably he would suggest you to wear a in-home tooth whitening agent, that he would give you a custom made trace which you can carry it home and wear it and get your tooth whitening done. Another side effect of tooth whitening is over the counter when they do it, it is not limited only to the teeth, and sometimes it can flow onto your gums and the gums could get burnt. a whitish layer of your epithelium can be seen over your gums, where your gums are getting burnt, and you would say that these gums are burnt, the teeth are getting bleached, but the gums are also burnt, and I don't know what to do. So that is why it is important that when your dentist does a home bleach tray, a specific custom made tray after taking your molds, he sees that this bleaching agent doesn't flow onto your gums. He makes the bleaching agent the way the trays are made. When he gives you an in-home bleaching agent or bleaching agent that you can wear at home, he will tell you the specified number of hours that you need to wear this bleaching agent, number one. Number two is he will see that this reservoir barrier is only on the teeth where this needs to be bleached and does not flow onto your gums. So it is important to take the suggestion from a dentist. Number three is if you get a bleaching done without, if you get a bleaching done on fluorosis teeth or without getting a cleaning done, you could suddenly have your fluorosis being more enhanced. You could suddenly have these stains being seen more over a whitish background. So it is good that you see a dentist before you go in and get any of these bleaching agents. You buy any of these from the counter or buy and use any of these bleaching agents. So coming to the question, is bleaching safe? Is it for everyone? Should everyone get bleaching done? As you know, everyone wants to get bleaching done. One of the most common thing that a lot of people, a lot of patients who come to us, one of the most common thing that they want to change about their face is their smile. And one thing that they want to change about their smile is the color of their teeth. So a lot of you want to get tooth whitening done, but getting it done in the right hands under the guidance of a dentist, a specialized dentist who can treat you the right way, give you the right percentage, and do the right treatment is very, very important.
Hi, I'm Ilham. I've been recommended by a family member to visit Dr. Gowd's clinic. I'm very happy with the professional service and the friendly staff. I had my teeth whitened and I think I'll be back.
Don't try tips that are given at home. Don't try using baking soda at home, using some other lime and baking soda. These tips that are meant for home bleaching will not work. Even if they work, they could have a lot of side effects. So don't try this at home. Go in for a professional tooth whitening system under the care of a professional, and he will be able to help you and guide you which is the best way to get your tooth whitening done. If you think that this video is being helpful for you or is going to be helpful for a lot of your friends and family who are probably getting this done or who want to get bleaching done, do share our video, do like our video, and do subscribe to our channel to hear more about more such tips, more such information which will be helpful for you and your friends and also for their dental health. Thank you.